Certainly, let's delve deeper into various aspects of pneumonia, including its pathology, detailed treatment options, prevention strategies, and more. Pneumonia occurs when pathogens invade the lung tissue, leading to inflammation of the alveoli, the tiny air sacs in the lungs. This inflammation can cause fluid accumulation, where the alveoli become filled with fluid or pus. This impairs gas exchange and leads to symptoms like cough and shortness of breath. Additionally, the inflammatory response, the body's immune response to the infection, can further contribute to lung tissue damage and the production of mucus, worsening respiratory symptoms. Symptoms of pneumonia can vary based on the causative agent and the patient's age and health. In infants and young children, symptoms may include rapid or difficult breathing, grunting sounds while breathing, fever and cough, which might not be present in all cases. In older adults, symptoms can be more subtle and may include confusion or changes in mental awareness, lower body temperature, also known as hypothermia, instead of fever, and general weakness. In addition to the basic methods mentioned, several advanced diagnostic tools may be used. Sputum culture involves collecting mucus from the lungs to identify the specific pathogen. Bronchoscopy is a procedure where a thin tube with a camera is inserted into the lungs to obtain samples for testing. Blood cultures are done to check for infections spread into the bloodstream. Pulse oximetry measures oxygen levels in the blood, helping assess the severity of respiratory distress. Antibiotic therapy. First-line treatments typically include macrolides like azithromycin or doxycycline for outpatient treatment of community-acquired pneumonia. Hospitalized patients may require broader-spectrum antibiotics, such as beta-lactams or fluoroquinolones, especially if resistant organisms are suspected. Antiviral and antifungal treatments. For viral pneumonia, antivirals such as oseltamivir, commonly known as Tamiflu, may be prescribed if influenza is the cause. Fungal pneumonia treatments vary by the type of fungus, for example, itraconazole for histoplasmosis or voriconazole for aspergillosis. Supportive care. Oxygen therapy may be necessary for patients with low blood oxygen levels. Intravenous fluids are often used to ensure hydration, especially in hospitalized patients. Respiratory therapy techniques like chest physiotherapy can help clear mucus from the lungs. Vaccination is a key step in preventing pneumonia. There are two main types of pneumococcal vaccines. PCV13, also known as Prevnar 13, is recommended for children under 2 years old and adults over 65, as well as those with certain health conditions. PPSV23 or Pneumovax 23 is recommended for adults over 65 and those with risk factors. Additionally, the influenza vaccine is recommended annually, especially for high-risk populations to help prevent viral pneumonia. Lifestyle modifications can significantly reduce the risk of pneumonia. Avoiding smoking is crucial, as smoking damages lung tissue and increases susceptibility to infections. Maintaining good hand hygiene through regular and thorough hand washing can reduce the risk of respiratory infections. Lastly, leading a healthy lifestyle with a balanced diet, regular exercise, and adequate sleep strengthens the immune system, making it more resilient against infections. Pneumonia can lead to various complications, particularly in vulnerable populations. Pleural effusion. Fluid can accumulate between the layers of tissue lining the lungs and chest cavity, sometimes requiring drainage. Lung abscess. A localized collection of pus that may necessitate surgical intervention. Sepsis bacteria or toxins can enter the bloodstream, leading to organ failure and requiring intensive care. Factors influencing recovery include the patient's age, underlying health conditions, and the pneumonia's severity. Healthy adults may recover within 1 to 3 weeks, while older adults or those with chronic illnesses may take longer. Pneumonia in children. Children, especially infants, are at higher risk due to immature immune systems. Vaccination and prompt treatment are critical. Pneumonia in the elderly older adults often present atypically and may experience more severe disease due to comorbidities. Pneumonia is a serious respiratory condition that requires timely diagnosis and appropriate treatment. Awareness of symptoms, preventive measures, and understanding the disease's implications are vital for managing health effectively. If you have specific questions or areas you want to explore further, feel free to ask.